Good morning. This is a 60-minute presentation for the Alternative Medicine College of Canada, and we will be talking today about digestive ills and functional tests in the naturopathic practice. This is part one of a two-part presentation. Today we'll be discussing functional testing for two reasons. Our first goal is to contextualize the following course modules: F445 about orthomolecular approaches and F343 about metabolism and nutrition. We'll also be discussing a little bit more about the types of functional tests that are usually offered in the naturopathic practice and that are generally not used by conventional practitioners, although they can be a very useful tool to help the client feel better. What is a functional test? Basically, it's a test that is able to detect a physiological or biochemical imbalance in the body when there is not yet an organic change to the tissues. Functional tests usually allow us to anticipate when something more sinister is about to develop, because based on the client's symptoms and running the functional test, we then know more about the imbalance creating these symptoms, even though other types of testing may not have revealed any organic or mechanical tissue damage yet. Functional tests are very, very useful in the naturopathic practice because we are usually faced with clients who may have had symptoms for a long time, and those clients will have already seen a number of general practitioners, or maybe they'll have already gone to see a specialist. And perhaps despite their symptom, when more imaging was done, especially in the digestive sphere for digestive problems, the client may have already had an endoscopy or a colonoscopy, both of which are very useful tools in the gastroenterology practice, but they will only show when there's already tissue damage happening, either in the form of gastritis, ulcers, duodenitis, irritable bowel disease, and so on. So sometimes the client will have seen their gastroenterologist, who will have said that all testing comes back clear, and yet the client is still not feeling well. So they will typically then walk into our practice and say, I have had all these tests done, and yet there's nothing wrong with me, but I don't feel well. It's generally a really good idea if a functional imbalance is detected, either through a test or just through the client's symptom, to treat it, because obviously the longer the imbalance lasts, the more the imbalance will create increasing damage and eventually lead to an organic tissue change, which will be harder to reverse and improve. So functional tests really are a very useful tool. We use a lot of functional testing when trying to work on clients' digestions. And so these are four very common tests that we use in the naturopathic practice. Perhaps the most common one is the IgG food intolerance test. The SIBO breath test is a much newer test that we've only really had at our disposal for the last couple of years. The baking soda test, also known as the burp test, is an extremely crude test, but that is obviously very cheap and doesn't require any specialized equipment. And the complete digestive stool analysis we've had for about 10-15 years. And it's quite an elaborate test that can be quite costly for the client. Today in part one of this presentation, we'll only be discussing the IgG food intolerance test and the SIBO breath test. We'll discuss the other two tests, the baking soda test and the CDSA test, in another presentation. Basically, when a client comes in with digestive symptoms, depending on the symptoms, we may choose one test over another. Obviously, there are other considerations like the person's budget, time, fear of intervention, and so on. If the person comes with a lot of bloating after meals, nausea when waking up, low appetite, and changes in bowel movements, we may consider the SIBO breath test more so than other tests. We'll discuss that later in the presentation as well. If the person has digestive symptoms, but they also have systemic symptoms or extra digestive symptoms, like for example, eczema, acne, joint pain, fatigue, headaches, menstrual pain, nasal congestion that is chronic, then we're thinking more of a food intolerance, and so we'd prefer to run the IgG test. If the person seems to have more gastric-centered types of symptoms, like a lot of burping, maybe a feeling of burning or acidity in the epigastric solar plexus area, we might choose the very crude baking soda test. If the changes seem more centered around the lower abdominal sphere, with diarrhea, abdominal pain, mucus, or traces of blood in the stool, we'd run the CDSA. Of course, if there are traces of blood or mucus in the stool, remember that this is also a red flag, which means that you will want to refer this client out to see their GP or specialist in order to do a fecal occult stool test, and maybe a stool calprotectin test, just to see the degree of inflammation in the gut, because blood in the stool can be a sign of a lot of more severe conditions in the GI tract. So always keep in mind that you want to have your naturopathic thinking hat, but you may be the first and only point of contact for this person, and so for our obvious medical red flags, you want to be a safe practitioner and you want to cover your back, so you do want to refer out when necessary. So we'll start talking about the IgG food intolerance test. So like we said earlier, we might suspect that a food intolerance is at play if the person has not only digestive symptoms, but perhaps extra digestive symptoms, or anytime we see an autoimmune illness, be it Hashimoto's or Graves' thyroiditis, rheumatoid arthritis, lupus. Anytime we have elevated antibodies, we have good reason to think that a food intolerance is involved. Again, we'll talk more about the details of that in a minute. A lot of people with recurrent infections, especially recurrent infections that involve mucus, like ear infections, sinus infections, bronchitis, and so on, this is often due to a food intolerance. So in those people, the food intolerance test can really be invaluable. So to understand the food intolerance test, it's obviously important to understand what a food intolerance is. Basically, a food intolerance is an immune reaction to a food that we tend to consume in large amounts or have done so for several years. It is actually relatively rare to develop a food intolerance to a food that we've only consumed a couple of times in our lives. Because it's an immune reaction, there is a combination of food particles and antibodies that clog together, and those can travel anywhere in the body, and for this reason, a food intolerance can elicit symptoms just about anywhere in the body, which is sometimes very difficult for general practitioners to understand, because the way conventional medicine is so categorized, it's hard for them to think that a food can actually create a symptom of nasal congestion, dermatological symptoms, menstrual pain, and so on. What makes a food intolerance difficult to elucidate is that, unlike a true food allergy in which symptoms manifest themselves within minutes after that food consumption, like for instance in the case of a peanut or a shellfish allergy, where only trace amounts of that food are necessary to create immediate and obvious uncomfortable symptoms, in a food intolerance, the immune complex will only start creating problems a few hours after eating that food, or even 1, 2, or 3 days later. So for a lot of people, there is no clarity between what they're eating and their symptoms. Sometimes they also don't even know that this is a possibility, which then makes it obviously very difficult to notice if they don't know that this could be part of the problem. One of the drawbacks of the food intolerance test is that it's generally quite costly. So a cheaper way of identifying a food intolerance would be to do a strict elimination diet for 2 or 3 weeks. And in that time, we would expect the symptoms to somewhat resolve. And then we would do a precise and careful food reintroduction process afterwards and see which symptoms become elicited after which foods. So the food intolerance test is a bit of a shortcut method for people to avoid doing that. One might wonder how a food intolerance develops, and for that we have to take a little look at our digestive system. So this is a very basic picture where we see the stomach being one of the first steps of digestion, followed by the small intestine, which is a few meters long, and then the large intestine. So what we're interested in particular here is the small intestine. Why we're interested in that is that the small intestine is the area where we will be absorbing most of the foods that we eat, the nutrients that we eat. So the small intestine is about 6 meters long. It's all folded onto itself, but if we were to unfold all the folds in the small intestine, we have a surface area that is about the size of a tennis court. This is a very large surface area of absorption for us to be able to absorb our nutrients adequately. You see here, what is in pink here is the small intestinal membrane, which is only 1 cell thick, which is really just a few microns. Above this pink line is everything that is found in the inside of the GI tract, or the lumen of the small intestine. And everything below that is actually our bloodstream, or our lymphatic system as well. So you can see in the top part of the picture that in our small intestine we'll have in green here a lot of partially digested food particles. So the digestive process started in the mouth and then in the stomach, and it's now continuing in the small intestine. We also have a very, very wide array of bacteria. So here they've only portrayed pathogenic bacteria, but we have a lot of beneficial bacteria as well. We also have viruses, fungi, organisms as well. We have drug residues in our gut from the drugs, prescribed drugs that we may be taking, but also, for instance, hormone and antibiotic residues found in the meat that we consume. We have toxins here in purple. That's from our generally polluted environments. So this may be like pesticide toxins from our produce, or it can be some ingested pollutants from our surroundings. Some of our stress factors can also affect this membrane. So normally this membrane is selectively permeable, meaning that the cells are very tightly bound together through specialized junctions called tight junctions, so nothing can go through except very well digested nutrients. What is important to remember is that because of the enormous bacterial population that is inside our GI tract in general and also in our small intestine, the body will place about 80% of our white blood cells just here at that small intestinal membrane between the bloodstream and the backside of those cells, so that in case certain bacterial toxins or bacterial particles were to penetrate in the bloodstream, the white blood cells are able to mount an immune response relatively quickly to try and ward them off. What happens is that when the gut becomes inflamed, either due to stress is one of the bigger things that will weaken this membrane. Certain drugs will also weaken this membrane. Having the wrong types of bacteria in our gut will do that. Or if the person has had a food intolerance for a long time that they're unaware of, it will gradually irritate and damage these cells. So the tight junctions will break, and basically a lot of residues from the GI lumen will be able to enter non-discriminately into the bloodstream, and the white blood cells will respond by creating a whole bunch of antibodies. Some of these antigen-antibody complexes will travel in the body and create extra digestive symptoms. They may settle in the joints and create joint inflammation. What can also happen is that the antigen immune complex creates a digestive symptom because the gut lining is quite irritated. And if some of these antibodies happen to cross-react with some of our own organ systems, then we have the development of an autoimmune illness, which is why in autoimmune illness it's always interesting to try and identify food intolerances through the IgG test. So when the gut has become very porous, we call that leaky gut, and basically just about anything can go through, and this really makes the bed for chronic illness. This is another interesting picture as well, where we see how everything is going into the bloodstream from bacterial residues, bacterial toxins, but also food particles like gluten, for instance. And then we have an immune reaction that is elicited through B and T cells. And we can have a number of antibodies that are created. They are all called Ig, which stands for immunoglobulins. So it can be an IgG antibody, an IgA antibody, an IgM antibody, or even an IgE antibody. And all of these antibodies can create a whole slew of symptoms. We now have evidence that the blood-brain barrier, which surrounds our brain, works very similarly to this membrane in our gut. And so there is good reason to suspect that if there's leaky gut, not unusual to have a leaky blood-brain barrier, and a lot of mental symptoms are now being attributed to leaky gut as well. So like we said earlier, although food intolerances in a way originate with an immune system reaction in the gut, where most of the immune system reacts, because these antibodies can either cross-react with some of our organs, like the thyroid, or antigen-antibody complexes can travel throughout the body and create symptoms, irritation. We can also have recurrent sinusitis, changes in bowel habits, and of course a food intolerance, but leaky gut in general, will create a problem of adrenal fatigue because we have this constant physical assault going on that creates stress. So the body will constantly need to put out that inflammatory fire from the foods we don't tolerate by using its hormone cortisol, which is created in the adrenals. So depending on our genetic reservoir, so to speak, the day we start being unable to produce enough cortisol to put out this fire, we will start developing symptoms of adrenal fatigue on top of our digestive symptoms and extra digestive symptoms due to the food intolerance. So it's a real far-reaching problem. So the food intolerance test essentially measures only one kind of antibody. It measures the IgG type antibody. So remember again, the immune system is able to produce 4 different types of antibody. You will have most likely heard of the IgE antibody. This is one whose total levels we can measure in the bloodstream. And this is the one that mediates what we call true allergies, like shellfish or peanut allergies. And it is also the one that mediates, together with the histamine reaction, what we see on a skin prick test, where various allergens are placed on the skin. There is a hive that is created if the agent that is put on the skin is indeed irritating. So if a client has already gone to their GP, has already had blood work for their total IgE levels, or maybe has had blood work for various IgE allergies like food or environmental, like dust mites, pollens, dog hair, cat hair, eggs, and so on, or if they've had a skin prick test, whatever was flagged as being positive on those tests, the person must absolutely avoid, even if they don't show up on the IgG test, which they may not because it's a completely different antibody. The immune system also has the ability of reacting through what is called the complement system. That is a slightly different pathway than the antibody pathway, and that is again not measured on the IgG test. So remember to explain all of this to your client, that a food intolerance is not a food allergy, that different antibodies are at play, and that the IgG test, although very expensive, really only does measure IgG antibodies. So if a food creates an immune reaction that is not mediated through IgG, but instead through IgA or IgM, this will come back as negative on the IgG test. Because remember, all we're measuring is IgG antibodies. So a person may say, on the IgG test, this food came back as not being problematic, but I know that when I eat this food, I really feel unwell. This is again a time to reiterate this information so they understand what they're paying for and what the value of this test is. The IgG test is a simple blood test. The person really doesn't need to be fasting. Basically, anybody can get it done. In children, the challenge is, of course, the needle. And it's a test that children below 2-year-olds should not get done, simply because it is inaccurate, which we'll talk about in a minute again. So here are some sample results from the IgG food intolerance test from my practice. There are different labs out there that will run this test. You generally want one that does not do ALCAT, but the ELISA IgG antibody test. So what will happen, and that's what you see in this middle column here, they will test a number of foods, so 100 foods, 300 foods, and then what will happen is that they will place this blood on a special little chip, and on the chip we have 100 to 300 food particles. And for every little slot where there's a food particle, we want to measure how many antibodies stick in that slot. If we find a lot of antibodies, so according to this lab, if you have more than 20 micrograms per milliliter of a certain IgG antibody, they will label that food in red on the report, meaning that it's highly immunogenic. If there's above 7 but below 20, this lab will place them in orange, meaning that the person should tread cautiously with these foods. And if less than 7 microgram per milliliters of antibody are produced, that food is labeled in green, and it means that it's not immunogenic and it's basically not a problem. So this is for a person who had eczema. And we can see, first of all, you can see different labs will do this differently, but that the veggies are separately from gluten-containing grains. They have a section for seeds and nuts, dairy, seafood, and so on. And obviously, the more you pay, the more foods you get to be included on this report, and the more thorough the results. You can see here right away that this person has a massive problem with gluten. Basically, all gluten-containing grains are coming through as very problematic and labeled in red. This person ate a lot of spelt bread, and so you can see spelt is the strongest reactive gluten-containing element here. They also have an issue with pretty much all dairy and eggs. This is unfortunately an extremely common scenario. That's because gluten, dairy, and eggs are extremely prevalent in our Western diet, and also because these foods have been very refined and found virtually everywhere in ready-made goods like cookies and crackers and so on. We find egg powder, milk powder, added refined gluten in croissants and bread, so the immune system starts flagging them. So you see this person needs to avoid gluten, dairy, and eggs for about 6 to 12 months, which is really quite long. They also react to cod and peppers. Normally, you'll see when discussing the reports with the client, there's a very real correlation with what their diet looks like and what comes up as red or orange on their report. So this is another person, so you can see the difference right away. This one really has a big issue with eggs, and even then, you can see their reaction is only about 26, whereas if you remember on the previous slide, the person was way above 100 for eggs. So actually, if I see a test like this one, I don't call it leaky gut. I just call it a food intolerance. That for whatever reason, your immune system has flagged eggs as being problematic. And I will tell them, just avoid eggs for 12 months and we'll see how it goes. The report before, because so many foods were a problem, so many common foods like gluten, dairy, and eggs, it is most likely already leaky gut. This is another lab that has a slightly different format, but basically it's the same principle. They have a cutoff, they have different units for what they label red, yellow, or green. And again, you see here, this is a person who had reflux and gastritis. In fact, they had Barrett's esophagus, which just means that they had gastroesophageal reflux disease for a long time, long enough that it's irritated the esophagus enough to create cellular changes which are precancerous. So this person, unfortunately, was taking Nexium every day as a treatment for their Barrett's esophagus, which as a naturopath I cannot recommend against because it was prescribed by another conventional practitioner. Although I do know that it is now well known that Nexium and all these antacid drugs, what they do is they alter digestion in the stomach by reducing stomach acid. So a large number of bacteria don't get neutralized in the stomach. And of course that sets the stage for pathogenic bacterial growth lower down in the digestive tract. And this of course sets the stage for leaky gut. And this is essentially what this person has, which I can already tell by seeing how many foods come up in red. Again, you see gliadin, wheat, couscous, barley, durum wheat, spelt. This person really has a gluten intolerance. They have an egg white intolerance, and you can see lots of nuts coming through: almonds, Brazil nuts, hazelnuts, cashew nuts. Nuts are actually quite allergenic for a lot of people. So this guy also needs to avoid nuts for a year. Brewer's yeast, that's mostly beer, for a year. And those are the main ones. And a little bit of dairy is coming through here in yellow. So this person really has leaky gut. But, when they have Barrett's esophagus, it's very likely that they do have leaky gut. But you want them to do food intolerance tests so we can quantify which foods are most problematic and, of course, help them avoid the adequate foods for that amount of time. So once you get the report, Basically, the foods labeled in red you avoid for about a year. Food labeled in orange you avoid for 6 months. Most people are unable to do this 100% all of the time. I tell them to be extremely strict for about 3 months. And then after this, they can experiment a little bit and they will usually feel where their personal threshold is. So it may be that if it's a gluten problem, if 5 days of the week they go gluten-free and on the weekend they go for brunch, they may be perfectly fine. But someone else may try this and realize they get a horrible stomachache, constipation, diarrhea, or a return of their extra digestive symptoms. So people do need to play around a little bit. Usually during that time of food irritant avoidance, it is a good idea to help repair the GI mucosa with a lot of supplements like zinc, probiotics, glutamine, glucosamine, slippery elm, and I will typically support the digestive system as a whole with digestive enzymes for the small intestine and sometimes hydrochloric acid in the form of betaine HCl if I feel like the stomach really needs a bit of support. Of course, that is contraindicated if a person has ulcers or if they have really bad gastritis, of course. Remember that the small intestine is very directly connected to the liver via the portal vein, which is a very large vein. So because the gut has been leaky, a lot of toxins like bacterial toxins, food residues, and so on have made it to the liver, which will then have to work extra hard to filter through all of that. So it is a good idea, especially to prevent some of these die-off symptoms or detox symptoms that will occur as the person cleans up their diet, to support the liver. For that, we have our classic hepatic herbs like black radish, dandelion, milk thistle. We also have certain nutrients to support phase 1 and 2 detox like B vitamins and so on, N-acetylcysteine, glutathione. So you do want to support the liver as you support the rest of the length of the digestive tract. The IgG test is not meant for children below 2. That is simply because between ages 0 to 2, infants have a naturally leaky gut. That's part of the immune system learning what is self and what is non-self. So the IgG food intolerance test is not reliable in those populations. Oops, sorry about that. My computer decided to do its updates. People who are taking immunosuppressive medications like prednisone or other steroids, cortisone shots, anything that is cortisone based, but there's also other immune suppressants like for people with rheumatoid arthritis, they'll take biologics and so on. Every lab is able to provide you a list of medications that will make the food intolerance test inaccurate, and so in these people you don't want to recommend that. Patients with really bad eczema who have used steroid-based creams for a really long time, for like Elomet, these cortisone derivatives will have penetrated the blood system through the skin, and it can invalidate the IgG test as well. Remember to educate your clients that you will have false negative results if an immune reaction is not IgG mediated, or of course if the person just never eats that food. Sometimes it rarely comes up, like for instance, sometimes in the kids, because they eat Nutella every morning, hazelnut comes back as a strong irritant on the test. And then you'll see, let's say, walnuts in orange. And the parent will say, well, but he never eats walnuts, so how could that come up on the test? Sometimes it is a cross-reaction, meaning that the antigen from the hazelnut is very structurally similar to that of the walnut, and so the antibody will cross-react with both. So again, you can educate your client about that. So now we'll move on to the SIBO breath test, which is another incredibly useful functional test in the naturopathic practice. This is a test that we've only really had for the last 5 years, and it is used to detect what is known as SIBO, which is an acronym for small intestinal bacterial overgrowth. This is something that has been recognized more and more in the conventional gastroenterological setting as being a problem. Basically, what happens is that if there's poor digestion in the stomach, foods will reach the small intestine not well digested the way that they should. Protein in particular will need to be digested better in the small intestine. But if that's not happening properly, residual food items will basically feed whatever bacteria is in there. And so the bacteria, as it eats all of these residual foods, which we call a process of fermentation, as a byproduct, these bacteria will produce methane and hydrogen gases. What happens is that these gases will distend the intestinal membrane, so that the nerves that are normally along that membrane get really confused, because normally those nerves only get distended when there's food coming through. But here they're getting more or less chronically distended. So that really alters a person's bowel habits. Either the nervous influx just really slows down and the person has constipation, or it's always on accelerated and the person has diarrhea, or both. Foods that are especially problematic at feeding these bacteria are the starches. Why a person may have improper digestion, the stomach and small intestine, is basically due to stress, which creates a reduction in stomach acid, pepsin, and other digestive enzymes like the peptidases, lipases, amylase in the small intestine. B, the consumption of antibiotics, which basically wipe out a lot of the good flora. So we have a latent negative flora that's in there. So as soon as you feed it a little bit, it just explodes into a whole bunch of negative bacteria. Another reason is taking any kind of antacid drug, Nexium, Zantac, omeprazole, ranitidine, and so on. So we have many good reasons. And of course, food intolerances. So the membrane is generally weakened and irritated, so it'll be harder to maintain a healthy bacterial population there. Just as a little aside, the nerve structures that are found all along the GI tract are collectively called the migrating motor complex, and basically they create a very organized sequential kind of waves that move from the esophagus all the way to the anus and essentially sweep through the entire length of the GI tract. That takes about 2 hours, and it occurs every 1.5 hours, and this is an essential part to allow repair and maintenance of the GI mucosa. So obviously when the migrating motor complex gets disturbed by the chronic gas distension due to the wrong kind of bacteria, the gut membrane has a harder time cleaning up, maintaining itself, and therefore bacterial population will grow there with a lot more ease than if that system was working properly. So it's essentially a little bit of a vicious cycle. So some very common symptoms of SIBO. The number one most common is bloating immediately after meals, or some people just feel chronically bloated and gassy. Nausea, especially nausea in the morning, that tends to improve as the day progresses. So a lot of times these people have no appetite at breakfast. They already feel bloated around their solar plexus. They feel really full. And they will usually have either constipation, diarrhea, or both. So all of these symptoms used to belong to what we called irritable bowel syndrome, which was feeling this way, but when these poor clients went to their gastroenterologist, an endoscopy was done, a colonoscopy was done, blood tests were taken, and there was nothing. So a lot of times these people were labeled as having mostly a stress problem and were given typically laxatives, for instance, if they were constipated, or antidepressants to manage their stress levels. Now that we have the technology to take a look at the bacterial population in our gut through, for instance, the SIBO breath test, we now know that 80% of people who had been labeled, diagnosed with IBS actually have SIBO. So they were told that it was all in their heads, and now we learn that it actually wasn't. So we've briefly discussed some of the causes of SIBO earlier, chronic stress levels, taking antibiotics, taking antacids medications. But actually another extremely cause of SIBO is having had a bout of gastroenteritis or food poisoning. Maybe viral, bacterial, it may be parasitic. So this is the scenario of a person who never had any digestive problems at all. Then they went on a trip and everybody in their party caught gastroenteritis due to bad water, bad food, and so on. And since that episode, even if they were treated with antibiotics or any other conventional prescription, well, now they have SIBO. They feel bloated, they feel nauseous, they have constipation or diarrhea. So unfortunately, gastroenteritis is a very common cause of SIBO. Thankfully, not everybody with stomach flus develops SIBO, but it is a common cause. So what the SIBO breath test is essentially is, it's a test that can either be done at home or it can be done in some of the more progressive gastroenterology clinics. So what happens is that the client is given a drink of either glucose or lactulose. Why we choose these solutions is because glucose and lactulose will feed bacteria, some of those bad bacteria that will make the gases that create the symptoms. So in essence, during this test, we are feeding the bacteria and then measuring their metabolic activity. So after the client has drank the solution, what they do is they are given a multitude of little tubes, test tubes, like you can see on this picture. And then at regular intervals and for 180 minutes, the patient has to exhale in every time in a different tube. And then what happens is that each tube is placed in a machine, and the machine will measure the concentration of methane and hydrogen in each tube. And we plot a graph, which I will show you in a minute. And basically, if you have too much gas at any point in time, we call it SIBO because what makes the gas is bacteria. So too much gas means too much bacteria, which means small intestinal bacterial overgrowth. So if the client decides to do the home test kit, they will be receiving a parcel like this one on the picture with a powder and instructions on how to dilute the powder and a lot of little tubes. The upside of the home test kit is that you can then just prescribe it. You don't really need to be working with a gastroenterologist. But the downside is that you're not sure that the patient is self-administering the test properly because, as you can see, it's a little bit of a complex test. Like the person needs to exhale at the right time in the tubes, and it does take 2 to 3 hours. So if you have a clinic that offers this test, they are more and more common. I feel like this is the preferred route because then it's administered to them by a trained nursing staff. And the results are usually a little bit quicker. This is a test that is not very expensive. It is cheaper than the IgG test, for instance. So there we have a choice as practitioners. Do we want to prescribe a SIBO test that is glucose or lactulose based? In the research, the gold standard or the more accepted solution to use is glucose, simply because using glucose seems to be a little bit more specific for the diagnosis of SIBO. It's less sensitive, but it's more specific than lactulose. Glucose gets metabolized very quickly in the proximal small intestine. So if the overgrowth of bacteria is distal, so at the end of the small intestine, a glucose test may miss that and create a false negative. Lactulose seems to be broken down more slowly, so chances are it will travel the whole length of the small intestine and it will pick up wherever the growth is, but is a less specific result, meaning that in a way it would be good to do both, but you need to pick one. So either one that you pick, it will give you good information, hopefully. And actually interpreting the results is not that straightforward. Like I said, this is a relatively recent test. So up until recently, clinicians and researchers didn't exactly agree on what was a positive. But recently we have had a consensus paper that was written by the experts. And basically, as you can see, there's a graph that is plotted where, for instance, from this lab, methane gas is in red, the red line, hydrogen gas is in blue, and then when you addition the two gases at any one point in time, it's the green line, which is the combined line. So you can see on the graph, every little triangle there represents the amount of gas either at 20 minutes, 40 minutes, 60 minutes, 80 minutes, etc., after having drank the solution. And the first one is the control. That's just to ensure the validity of the test. And then on the y-axis is, the concentration of gas in every tube at every one point in time. So if there's a rise in hydrogen gas of more than 20 parts per million in the first 2 hours, or a rise in methane gas of more than 12 parts per million in the first 2 hours, or if when you addition both gases in the first 120 minutes, there's a rise of more than 15 parts per million. All of these are potential scenarios that you would call positive. Okay? So it's also important to correlate that with the patient's clinical picture. So for example, here below is a client who is very constipated. So his GI transit is actually slower. So we see here that the peak seems to occur mostly around 140 minutes, but we still consider it positive because anyway, our combined rise is quite high. It's a total of about 35. And we also see that our hydrogen gas is somewhere above 20. So it is a positive test, even though the rise occurred after 120 minutes, because we know that this is a very constipated client, and so their GI tract just functions really, really slowly. So this would be an example of a positive test. This is another test result, so you can see how different they can look. So clearly this person doesn't really have a problem with hydrogen because the blue line, just makes it to the 20. But the bigger problem here is methane. So you're seeing a rise in methane. It's elevated at baseline already, which means that already at 1, 2, 3, and so on, it's high, and it just keeps on rising. So a lot of people with mostly a methane problem tend to be more constipated, and you also see these numbers rising really high, like in the 80s or 100 for methane. That means that there is a true problem with methane producing bacteria. This is another test result. So this one is what we call a borderline positive because we see a rise, but the rise isn't very high. As you can see, the rise in hydrogen is below 20 and the rise in methane is below 5. So actually I would call this a negative test. So there is a rise, but just look on the y-axis compared to the test that was done previously, the results I showed you previously. We're not going anywhere close to 80, 90, or even 40. We're staying well below 25, even for the combined values. So that is what a negative test looks like. It is normal as we approach the end of the test to see the rise anyway, because remember, as we're approaching the colon, we are exposing our sample to anyway increasing amounts of bacteria. So fermentation in the colon is somewhat normal. So you would expect to see a rise very late in the test anyway in just about everybody. This is another test which is actually a false negative, because we should never really see this to have high baseline numbers like you see here, 40, 60, plotted at number 1, and then see those levels go down. Like I said, if anything, we should see a peak towards the end of the test anyway as we approach the bacterial population of the colon. So to see these decreasing numbers throughout the duration of the test tells us that there was some sort of mistake in how the test was administered, very likely from a person who did a home testing kit. So it is important to take a look at a number of reports so you just develop an idea of what a positive SIBO test looks like, because every lab will chart it slightly differently, and because a lot of the time the gastroenterologist won't have heard of this test. Remember, it's a new functional test, so your client may rely only on you, their naturopath, to assess what their test results said, and of course to direct them towards a treatment plan. This is another interesting test result. So again, you see the combined values rising really high. We're pretty much around 90 here. Both hydrogen and methane seem to be rising. So this is a positive test. And we just see a progressive rise all along, but the top numbers rise enough to alarm us. And both gases are rising higher than they should. So this is a case of combined hydrogen and methane producing bacteria in this person. You will usually see a pretty good clinical correlation. It's important to remember that if the person has very classical symptoms of SIBO and their SIBO test comes back negative, it's always important to remember of SIFO. So this is one of the limitations of the tests I didn't write down here, but essentially that SIFO is small intestinal fungal overgrowth, which means that the SIBO test says it's negative, but the person does feel bloated and horrible. So we think now that there might be another gas that is being produced by yeast organisms that are not being detected on this test. So for me, when the SIBO test comes back negative, but they still have symptoms of what I would think is SIBO, then I call it SIFO, and I treat it with yeast-busting elements. And that is also why when we'll talk about the treatment plan later on, there are also a number of conventional antifungal medications that are usually administered if there's a GP or a prescribing doctor working with them. So the breath test limitations is that you need to follow a strict diet in the 2 days before the test. You need to stop any supplements 2 weeks before the test because obviously supplements are bacteria. So they will add bacterial population that will be picked up by the test. And that bacterial population may just be passing from the supplement you took, and it may not actually be your resident bacterial flora. Generally speaking, this is a test that you can do on children, but you need to assess the child as to whether they're able to listen to verbal instructions and properly exhale and so on. So for most kids below 6, it's going to be a bit difficult, especially because you need to collect the gases for several hours after drinking the glucose or lactulose solution. So for a lot of children, this feels very, very long, and it can become very difficult to ensure that the sample was taken properly. Now, if the SIBO test comes back positive, what is the treatment? There are basically two streams that the client may opt to take. They can go towards the antibiotic approach, or they may want to do antibacterial herbs. There is one published article that has compared the two and shown that they are pretty much equivalent, meaning that both are a little bit hit or miss. So if the person chooses the antibiotic, the classical antibiotic that they use is called rifaximin. It's a very expensive antibiotic, and it needs to be used for 10 to 14 days. It generally doesn't have a lot of side effects except the typical die-off symptoms that you might expect, meaning more bloating, more nausea, and so on in the first week of the treatment. Some practitioners will combine this with an antifungal drug like metronidazole or nystatin. Okay, but either way, it would be about 2 weeks. After that time, we would do 2 weeks of probiotic treatment, wait 2 weeks, and repeat the SIBO test. So that is the textbook way of doing it. A lot of people will never repeat their SIBO test because it is a bit of a hassle to take that test. And because if they feel better, well, they don't really see the point. As a practitioner, you do want to encourage that so that you know what your treatment plan has done. Sometimes we'll also have the opposite problem where they've undergone the treatment and then they still have all the symptoms. So you want to measure again because maybe although they're still symptomatic, we will see a reduced production of gases and we know we're headed in the right direction. If the person doesn't want to do antibiotics, either because they are not really for them or because they feel like it's too expensive, we can also use antibacterial herbs, but then the whole process may take a little bit longer. The herbal treatment looks like this. For 2 to 4 weeks, sorry about the typo, it's weeks there, missing the K. You want to use berberine containing plants like berberis, either vulgaris or aquifolium, and golden seal or hydrastis, which are very helpful for the whole mucous membrane to regenerate and have strong antiseptic properties. You can also use oregano essential oils, just use it cautiously. So for sensitive people, you really may need a reduced dosage. Neem is an Ayurvedic herb which has also been studied for SIBO. And if there's a problem with methane, then we recommend allicin, which is a garlic extract. After that, you would use a probiotic that does not contain a prebiotic for 2 weeks. So remember that prebiotics are special starches that probiotic manufacturers may include in the capsule. And the purpose of that is to feed the probiotics in the capsule. So remember, if you're giving them probiotics and the capsule contains a starch that is special to feed bacteria, you may actually be indirectly feeding the wrong types of bacteria and create a relapse of their symptoms. So you really don't want to be using a prebiotic. Remember that SIBO is actually extremely stubborn. It usually takes quite some time for that imbalance to develop. It's not unusual for people not to respond to their first treatment and to need multiple rounds of treatment in that first year after it was diagnosed. So relapsing is extremely common. When the client is being treated for SIBO, during the eradication phase, so either the antibiotics or the 2 to 4 weeks of herbs, you want them to eat normally, normal starch amounts, because you want to be actively feeding the bad bacteria. Why we're doing this is that we have evidence that a lot of these pathogenic bacteria will hide in what is called the biofilm, which is a thick layer of mucus that lines the intestinal mucosa. And actually, these bacteria have the ability to hide underneath that mucus and not be touched at all by the antibiotic or antibacterial herbs. So the assumption is the more you feed them, the more active they become, the less likely they are to hide in the biofilm, and so it'll be easier to eradicate them. After you're done with the antibiotic or the antibacterial herbs, you want them to go on a low FODMAP diet. A low FODMAP diet is essentially a low starch, low carb diet. You can find a lot of information about that. There's some research out of Monash University, and there's even now a few FODMAP apps that people can download on their phone. So they need to do that typically for several months, and it's more about relapse prevention. So you're eating in a way that doesn't feed bacteria, because bacteria, or these types of bacteria, don't really like fat and protein, but they love sugar and any kind of starchy foods. Sometimes what's happened in SIBO is that the migrating motor complex was damaged. So you also want to use prokinetic agents, which means agents that help the nervous system in the gut find itself again. So the most common one in the naturopathic world is called Motil Pro, and it's a product that contains 5-HTP, which is a serotonin precursor, a bunch of herbs, and ginger. So some people don't tolerate the ginger. It creates a burning sensation, especially if they have a history of esophagitis. So then you just need to watch out with the dosage and just warn them that this may happen, because obviously you don't want any more damage. A lot of times how SIBO has established itself, like we said earlier, is because of inadequate gastric acidity. So you may want to reestablish that with things like betaine HCl supplements, or things like gentian or bitter herbs in general. Another thing they need to do in the several months that they'll be treating their SIBO is to leave long time interval between meals, because that's when the migrating motor complex gets to do its healing, repairing, nourishing, sweeping motions, which will only complement what you're trying to do, because the sweeping motion will help get rid of the bacteria. So we've now come to the last slide of our presentation. So as a little summary of everything we've discussed, and it was a lot of information, we talked about what functional tests were, and that there were 4 main ones that we use, especially in the treatment of digestive symptoms. If you remember, it was the SIBO breath test, the IgG food intolerance test, the burp test or baking soda test, and the complete digestive stool analysis. In this presentation, which is only part 1 of 2, we only discussed the 2 first ones, the SIBO test and IgG test. Remember that depending on what kind of symptoms a person presents, you will use these different tests, and that each test has its set of limitations that you need to inform your client about. Remember that these are functional tests that are really not well established in the conventional setting, so you may have to face, educating a client about those, and they may say, well, my doctor's never heard of it, or, my insurance won't pay, I have to pay out of the pocket. So it's about really showing your client the value of this test, and also that presumably if they've come and seen you, it's because conventional treatments have failed and conventional investigative techniques have failed, and they need something that is maybe not as much in the mainstream. Although definitely the IgG test, a lot of general practitioners are now doing, and the SIBO test is trickling into gastroenterology clinics. So we've now come to the end of our presentation. I hope you found it very useful, and wishing you a great end of the day.